that's great that you've made so much progress already. And there's more, and there are other realms. And I highly encourage you, now that you've got that connection with your body, to take it to the next level. And I really want you to call this lady. Tenay will help you take it to that next realm.
I love collaboration. That's my heart. I love the magic that happens when you get multiple people in a room. Once two people interact, they're both permanently changed. I'm here to help collaborate with whoever else is on your healing team. If you could get 4 or 5 healing team members all on a call for 30 minutes, once a quarter, I think it could really catapult their understanding and therefore their approaches and how to progress to the next levels of healing.
Welcome to the Tenay Benes podcast, where I bring together a variety of experts in the field of helping you live a happier, healthier, and more fulfilling life. With us today is Claire Darling and Tenay Benes. Claire is a licensed massage therapist who specializes in nervous system healing through reflex integration, glial support, and biofield tuning. She helps clients unwind long-held stress patterns and restore clear communication between the brain and body. Tenay is an entrepreneur, author, and spiritual coach with extensive experience in trauma and chronic illness healing, both personally and professionally. She helps her clients bring clarity, direction, and empowerment to their spiritual experiences and their healing journey. This is an amazing collaborative experience. I know you'll enjoy it. Tenay and Claire, let's get started. Can you give us a little bit of background on what you do professionally, how you help people, and what are the different areas that are included within your area of focus?
Sure. My license to touch is as a massage therapist, and I was blessed to have instructors early on who encouraged us to really go deep with the magic that is available with the connective tissue and the fascia, which now is getting to be very popular and well known, but 20 years ago it was a little quieter. And I also have been blessed to have people modeling throughout my trainings how much of our emotional lives and our spiritual lives are really alive in our bodies. And so there are massage therapists and physical therapists and every other kind of therapist who really stay very, very mechanical, which is cool. You can do so much from the mechanical when you're working with a physical body. And there are people who have noticed those other connections with the spiritual, mental, emotional realms, that those are also alive in the tissues. And so some people are really adept at helping the physical crunchiness or disorganization or contraction that might be in the tissue to come out. And sometimes that will come out with a physical response from the tissues, like heat or trembling. And sometimes it comes out with more of what looks like an emotional response, like crying or laughing or both. So I kind of love to just be present with whatever the body wants to bring up and however the body wants to bring up. So I've pursued a ton of trainings so that I can just be present with what that body wants on that day as much as possible.
So it sounds like you help a lot with the mind and body and the nervous regulation. And if I might say, helping emotions maybe get unstuck, or helping things that are maybe traumatic episodes that the people have been through, you help the body and the mind process through that together.
That is true. I just want to be really clear that I'm not a counseling psychotherapist and I don't pretend to be one on TV, and that I'm always staying in my scope of practice and I'm always being present for what the body is requesting. Because if we really, really listen, there is no better expert on what that body needs than that body itself. So honoring the inner wisdom of each individual human is the deepest joy I think that I've ever found. Yeah.
So you've learned how to listen to the body, how to tune in to what the body is saying throughout the body, throughout its systems, tune into that, and then help facilitate the body to get what it needs.
Very well said. I wish I had said it that succinctly myself. Yes.
Awesome. And Tanai, could you give us a little bit of background on your focus as a spiritual coach with trauma and chronic illness?
Sure. My background is a little bit of a jack of all trades. I have an undergrad degree in biology, did Army Intel for 20 years, got an MBA, entrepreneurship, and am now in the world of technology. So I am very much a person who enjoys connecting disparate areas of specialty together in order to achieve a certain impact. Right now, working with you, my husband at Benes Companies, we help people and organizations improve chronic illness outcomes through technology. I'm a grad student at CU Boulder Information Science Department, developing a health recommender and collaboration website. Through our company, media, blogging, have a book out, and Claire Darling is one of the recommended healers in that book, Heal or Die, and also a speaker. And then through community events. So I'm launching a series of community events as a spiritual coach. The first one will start in January. It will be a spiritual awakening to Christ cohort, and it will meet 12 times over 6 months. So that's kind of the position, the hat with which I'm going to come to this podcast today, is a healer in the spiritual realm who really tries to help people hear spiritual guidance for themselves, not coming to someone else for guidance, although that is also helpful. Sometimes I got to go to Claire to get my body work done. It's not enough that I roll out my body myself.
And I
But
go to Tenay, even though I also do my own prayers and clearings. Yes.
exactly. So I like to empower people to be able to hear for themselves. And then also, you can go to other people to help them get guidance for you there. And because of my long background and in my personal chronic illness healing journey, a lot of the guidance that I help people receive is around their healing. What next steps should they take? When is the right time to go to Claire versus when is the right time to go to a physical therapist, right? And because a lot of these chronic illnesses are so complex and multifaceted, and our academic research really hasn't caught up yet to how to coordinate that care to achieve the most optimal outcomes, then I say, let's ask the spiritual realm and let's walk out that personalized journey for us.
So you help people essentially tune into their higher power, their inner voice, higher self, however you want to say it, and to get guidance for their own life and specifically how to heal from things that are holding them back, things like trauma, things like chronic illnesses, and you help empower them and give them a resource for guidance on how to navigate this as yet very undefined journey.
Yes, those are some of the ways that I help people do that. Yes.
Thank you, both of you, for doing that. And I'd like to go into a little bit of cultural and systemic analysis with you. Basically, we in the American Western healthcare system have a certain terrain in which we operate when we're helping people. And there are positives and there are negatives to that terrain. And I'd like to kind of focus in a little bit on how have you experienced the ability to integrate with other practitioners, other professionals, versus how you might have experienced being maybe siloed off into your own kind of corner. Have you experienced very much acceptance across the board, or is this something that you have kind of had to fight just to get a voice or to be able to partner with other people who work in different domains? What has your experience been in that way?
Gracious. That is a really broad question. I would like to, I'd like to answer it for LMTs in general, and then for me specifically. They're easy. As a massage therapist, you can say, "Oh, I'm gonna go hang out in the spas. I'm gonna do sugar scrubs and chocolate wraps on people's skin and just really make them have that relaxation, which brings wellness," right? That's beautiful. And it's also pretty easy to say, oh, I'm a medical massage therapist. And then you do kind of different kinds of trainings and you get employed at different kinds of places, right? And so you can choose very concretely and clearly, like, I'm going to be in this silo. I'm going to be in this silo. And a lot of people who end up self employed, which was my goal, and I did that. Then more of a question. And there definitely are people who kind of hook up with a chiropractor or a whatever, and then they get a lot of referrals from that naturopath or whatever, and they go back and forth, right? What I found for myself, well, first of all, I had so many circles of acquaintances that I didn't need any referrals. My people were referring each other or whatever. I love word of mouth. It's beautiful. And I found that when I was in contact or working for someone who was responsible for referrals, those referrals, I'm sorry to say, were not always in the best interest of their patient or their client, right? Because if you get social points for referring somebody to 5 practitioners, the fact that their brain after brain injury could only tolerate 1 session a week, that's in conflict there. So what I witnessed was it's really hard for practitioners who want to be responsible for those cross referrals and who want to be responsible to what is in the best good of the patient. It can be a juggling act. I think that's the most professional, kindest way I can say that, which will tie in later, I think, in the conversation to there are so many beautiful integrative clinics, especially in the Portland metro area where I am currently, but really all over, where you do have like an acupuncturist and a chiropractor and a naturopath and a medical doctor and a PT and a massage therapist. And it's so cool because but what I find is that I wouldn't want to be in that situation because I might want to refer them to a different naturopath. And I want that autonomy to do what is best, not for the business, or for my friend even, but for that patient. And so that's one little fly in the ointment that we can talk about maybe, or you can solve it. That would be great. Just solve it.
So, Claire, what has your experience been when you have had to reach out to collaborate with people, especially in maybe a more mainstream area of medicine or wellness? Has that been something that you have found just an open door? Have there been systems in place to make that happen? Or is this something that you had to really go beat the grass and find and look around for anyone who might be open to working with someone in your field? What's your experience been in that way?
I'm going to take the responsibility to say I have mostly not been successful in collaborating with the more mainstream practitioners. And, I don't know to what degree that's just because there's not a lot of respect for massage therapists out of the gate, or um, I can't say exactly why, but for example, when I'm working with someone who has TMJ dysfunction and I am aware of the connections with cranial nerves 5, 7, and 10, and I'm trying to, tell the body how much we trust it and we're listening to it with compassion. And I'm working with these tissues without any force and sometimes even without direction, but just with offering invitations. And then if they go to a very well-intentioned, caring, highly trained and credentialed PT or dentist or whatever, in between the sessions, that person might use a whole bunch of force. And it's exactly the opposite of the message and the communication and the relationship that I was trying to build with that tissue. And so it really ends up being kind of like, I think we have to choose one or the other. And so I often have ended up telling people, do what feels best and true and right for you. And when you're finished with one approach, if that's not me, then you can come back to me. But it's not fair to the body, I think, to be doing two different approaches at the same time when the approaches are actually in opposite directions.
So it
I don't know
seems
if
like there's a little bit of a lack of ability to coordinate the type of care together in a way that is beneficial to the client.
I have had difficulty doing that, I will say. And even reaching out with a client who had a knee replacement surgery, I just asked the surgeon how much range of motion is the maximum that we can expect from this joint so that I can work with the muscles around it and really optimize them, and never heard back. That's been my experience, but I know that is not universal.
Tenay, how has your experience been with both as a spiritual coach and someone who's brought in a lot of different areas, a lot of different techniques, a lot of different things into both your own healing and people that you've worked with? How has your experience been of, I guess, the level of acceptance that your field has in the broader wellness and medical space? Is this something that you've had open doors everywhere, or is this something that you've had to really kind of bash some of those doors down to get the help that you needed or that your client needed?
Definitely not open doors everywhere, which is interesting because historically, healthcare and spiritual care have been very deeply intertwined in a lot of traditions. Not only in the Christian tradition, which is the flavor of spiritual coaching that I do, but in several other traditions where, it's people who pursued spiritual wellness were the ones who were also kind of getting guidance about like, and we need to do this for the body, and we need to do that for the soul, um, but in Western medicine, from the advent of the scientific method, with that came a parallel concept of naturalism, which is that the spiritual realm doesn't exist. Now, the scientific method has actually nothing to do with naturalism. These are not connected in any way, shape, or form. However, culturally in Western medicine, Western academic practice, people believe that they're the same. If you're going to be scientific, which means that you're doing a structured, methodical observation of a situation, there's a before state, there's some sort of intervention, and then there's an after state, and then you can hopefully prove some causation of did the intervention actually cause that after state. Right? That's the whole basis of science. And you're proving and disproving hypotheses. Naturalism, is that only what can be observed and experienced with the 5 or 6 biological senses is real. Naturalism is a much more of a philosophy or even a theology than it is a scientific method.
As much
So
as they would hate to hear that.
it is. It's absolutely right. But I am here to argue that human beings actually have spiritual senses that just have not been measured yet because of the intertwining of naturalism and the scientific method. We don't try to observe and measure senses that we don't physically see. We don't, see an eyeball. We see an eyeball, a nose, a mouth, so we measure those things and we know that they exist. But I believe that we have spiritual senses and we just need different measurement techniques for them. Right. As a spiritual person, when I interact with healthcare professionals, usually in my own navigating my own illness journey and healing journey, I tend to couch what I'm hearing, the spiritual guidance I'm getting as, this is my intuition, or this is my preference, or this is my informed, patient power to choose the types of treatments that I want to choose or the testing or whatnot. But for some, as I build relationships with the care providers, then I can say, like, honestly, I was praying about this and I heard this random thing, and can we check that out? And um, my experience with that is when I receive spiritual guidance to tell my care provider to not work on my hip today, physical therapist, but work on my abdomen and this specific part. And then he does. And then it causes this huge shift in all of my fascia and my mechanical movements and all that stuff. After that happens, well, the first time, they're pretty eager to get my input on how I think, we should structure our treatment together. When it comes to helping other people, I tend to interact just directly with the patient, right? I don't like calling people patients, but we're in this healing environment right now. I tend to interact with them and then help them hear their own spiritual guidance and give them a sense of confidence in what they're hearing and help them devise strategies on how to interact with their primary care medicine or their massage therapist or whatever, so that it's a meaningful way. The most important benefit to this, I believe, is addressing that issue that Claire just mentioned, which is that sometimes, when we have too many experts and too many social media influences and too many, Google results when we search up our symptoms and too much WebMD, we end up doing this kind of information overload. And we don't know which of these pieces of information and potential puzzles to our healing problem, we don't know which one to do first or in what order, right? And that's really hard, right? Because Claire's a very capable LMT, and there might be a very capable dentist in the picture with TMJ, and there might be a very capable physical therapist and very capable chiropractor. And they all have things that have worked for them, but how do you know which of those things are going to work for you personally? And maybe it's a combination, but it has to be at the right time and the right sequence and the right manner. And that is where being able to tap into spiritual guidance for yourself, not having someone else, a fifth person, telling you what to do, but rather for yourself, and then saying, okay, I feel like the first thing I need to do is go to Claire. Then after she releases some of the tightness, maybe I go to the physical therapist and he gives me exercises to create a new movement pattern or generate strength in it in a new way, right? And then maybe the dentist can, in the meantime, give me a block to not grind my teeth or shut my jaw tight, right? So that kind of coordinated care, the coordination of care, is where spiritual guidance can really come in.
And I seem to
100
remember in your book tonight, this is something that was really important for you, where there were so many different options, so many different things that you could try, and you needed to know, what do I do first? What do I do second? Do I do this, or is this not for me? And for you, that became a really huge part of your healing journey, was tuning into the voice and understanding, is this the right practitioner for me, the right time for me, the right modality for me, or should I shift? And you have many different exercises that you do in your book, in the appendices, where you talk about different ways of doing that. But I see that being a really huge part of it, is just filtering through. There's innumerable bits of data out there, and tuning in to have a sense of what's right for me right now is a huge part of what you bring to the table tonight. I want to focus in a little bit more on, what about each other's fields? Have you experienced siloing or maybe ostracization or anything of each other's fields, where perhaps tonight, have you experienced people who are very spiritual to the point where they neglect taking care of the body? Or Claire, have you experienced people who are very into physical therapy and very into all that, but they completely neglect their intuition or their higher sense of knowing or anything like that?
100%. Tanai, you want to do it first?
No, please, you first.
Oh my gosh, I have so many anecdotes I could share going both directions. There are many, many times where someone maybe is just feeling like they're going to fix every single thing in their life using energy work. And so they pick their way of doing energy work and they stick with it. And even when it's not yielding results anymore, maybe it did, which is why they chose it, right? But at some point, it's not working for them anymore. And so then they start hopping around with different doctors and they start doing this and that, and they're not getting anywhere, and then they go get surgery, and it's like there's a lot between energy work and surgery.
Mm-hmm.
If you're dealing with the mechanics of a body, there's a big continuum there, right? And I've also seen it the other way, where someone is absolutely in their safe place of protective denial, I'm going to call it. I'm not judging it for 1 nanosecond. But if we deny the emotional reality of our bodies and we can't get present with that reality, and we're just trying to fix it mechanically, I'll just say, in the physical realm, then likewise, if the body needs to express emotional content, energetic content, spiritual content, you're not going to heal no matter how high the expert is that you go to see for that mechanical approach. Mechanical approach ain't going to work. So you better hope that you go to an expert who has enough assessment tools that they find out, oh, hey, what's going on here? You need to go talk to Tanai.
What about you tonight?
Assessment is like everything.
Yeah. Diagnosing It's a real issue.
Yeah.
Yeah, it's fascinating, right? My experience of Christianity and including Catholicism, there's a wide spectrum of how people engage with the spiritual realm in their healing journey. On the one hand end of the spectrum, there's I do spiritual things in spiritual places, right? So I go to a church or a worship service or a mission trip, and I do spiritual things there at a certain designated time and place. And then when I leave that place, I switch to a very naturalistic or mechanical approach to life. And then on the way end of the other spectrum is people who are very excited about spiritual things. And so they want to handle everything from a spiritual realm. So if they have a problem with their, jaw, they pray for healing. If they have a problem with their finances, they pray. If they have a problem with their job, they pray. If they have a problem, but that's all they do. And they don't actually do any of the other work. They don't address the tissues. They don't go learn about what could be causing this, the connection between TMJ and trauma, for example. Like they don't do any of that stuff. And so then they're frustrated that the spiritual thing is not working. Prayer in their lives, usually it'll work for, say, 1 out of 4 of those situations, because 1 out of 4 of those situations had a spiritual problem. And therefore, the spiritual solution fixed that problem.
Exactly.
Then they're frustrated. They're like, and then they start saying, well, the enemy is trying to block my prayers. Well, like I would argue that, one of the things that I really try to help people learn and grow in is when you bring a problem before your higher power, spiritual realms, the kind of guidance you want to ask for is not just a petition of, here, please fix this. Here, please fix this has its time and place. But usually there's a few steps before, which is, hey, what's the problem here? What's the real problem? Like, what's the root cause? Give me that guidance, 1. And then 2, what is mine to do to fix that problem? What is my neighbor's to do? Like a certain healer that you might need to send me to, or a friend or a stranger who happens to have understanding about this. And then what's the spiritual realm's part to do, right? So like there are these 3 buckets, and now let's coordinate all of that together. And that's the kind of guidance that I really try to encourage people to pursue in their healing journey, or any journey, their marriage journey, finding the one that they want to marry, or their financial journey, getting out of their financial state into a better one, right? So it has to be a combination. When it comes to interacting with massage therapists, I also see the spectrum. On the one hand is a very mechanical approach, and then there's the medical mechanical, and then there's the relaxation mechanical. And I love all of that. I'm a big massage person. And on the other hand is a very spiritual massage therapist experience. Like I've noticed, of all the alternative healthcare practitioners that I've worked with, massage therapists tend to be the most tuned in to spiritual things, actually, of all the ones that I've met. Naturopaths and chiropractors and integrative medicine doctors and doctors of osteopathy, like massage therapists, they're the one, right? And I think that's because they tend to have to, I don't know, because the body,
Intuitively true.
yeah, exactly. Claire was saying the body is the place that captures spiritual things, and it captures emotional things, and it captures physical, mechanical problems, right? And then they have to kind of sift through all of that.
We'll get back to that conversation in just a minute, but I have a quick question for you. Do you know anyone who is working to improve other people's lives, perhaps aren't getting the credit or the recognition that they deserve? Reach out to me and I would love to feature them on this podcast. Thanks. If you've been enjoying this podcast, you might be interested to know about some other resources that we've been developing. Search BenesCompanies.com and you will find books, podcasts, and other resources that we've been developing to help you live a happier, healthier, and more fulfilling life. All right, let's get back to it. So I'd love to dig into a little bit more about what you just addressed there tonight. Is what is the positive side of this? What is the benefit that you have seen of people combining these different approaches in the right way, where people are open to these different modalities and then perhaps they use their intuition or higher power guidance, that sort of thing? What type of benefits have you seen for people who have actually combined these and gone to these different areas, different disciplines of care? What have you seen as a result of that?
Is that a question to Claire or me
To
or?
you tonight, but I do think we should underscore that is such a great question, Brett, but also I want to underscore what Tanai was addressing about empowering people as that central bucket, because no matter what collaboration is happening with your practitioners and the team that you assemble, and no matter how magnificent and magical they are, it that is the primary bucket that has to be, polished or filled or whatever has to happen. But I just wanted to really underscore that piece before we leapt to the collaborative practitioner. So sorry for that intrusion.
Empowering someone to be their own primary care manager in a way, like to go to these different places based on their intuition.
Yes. And intuition can be informed by lots of things, and it can mean different things to different people, but to really be empowered to make the discernment based on their own body and other ways that they get guidance, which like Tanai can teach lots of ways. So yeah, but just to make sure that the patient or the client doesn't get lost in the search for the perfect practitioner or the perfect modality. It's like, no, no,
Mm,
no, you are the perfect practitioner. You are the modality.
mhm.
That, and tonight really, I think you described that really well, how crucial it is. I just wanted to underscore before we focus on
I
the
think that was
practitioner.
one of the lessons that you learned tonight was and I think it's in your book where you talk about you are your first advocate. You are the primary person, and you cannot look to anyone else to be that. You have to be that person and take responsibility for your healing journey. But I'd love to see both in your own personal journeys, Tanai and Claire, and in the people that you've worked with, what have you seen when people have combined the different areas of care, different modalities, and combined the spiritual and the physical in your different areas, your different fields of work? What have you seen for the people who have done that well?
Well, usually in my area of care, spiritual guidance will overcome obstacles or overcome barriers or overcome some sort of stoppage or blockage to healing. Then once you do whatever it is you are hearing to do, then you can kind of go back to what your other care providers are telling you to do, and then it ends up working well. Right. So, for example, I recently did this for a client. She had an appointment with a massage therapist. She'd been receiving Bodywork pretty regularly, and I already taught her over the years how to get spiritual guidance for herself. So she reached out to me and she said, I would like to schedule you call in when I'm at my massage therapist for my next appointment. And I would like your help praying to help my body receive the thing that my massage therapist is trying to do, but it's not working for some reason. I've kind of come up against this obstacle and I don't know what it is. I said, okay. So she calls me when she's at the massage therapist, and I go into healing prayer mode, which is different from spiritual coaching mode, right? Healing prayer is like, okay, I'm going to ask my higher power to tell me what to say, what to see, what to pray, and even any intuitive, words of understanding, knowledge that I can share with the massage therapist or the person who's on the table. So, she called me, I started praying. I saw some trauma related issues that were manifesting in her body, fascial patterns. And I prayed, did some inner healing prayer for her just to help her connect with God. In that moment, that part of her that's traumatized and is kind of scared of this person touching her body, to have that child part of her connect with God, feel safe, be integrated into the rest of her, and then now from a place of safety and strength, be able to receive the physical care that will help her body release the memory and the pattern from that traumatic memory. And after I prayed for about 10 minutes, I didn't hear anything in the room, but I God say, okay, it's done. And I said, okay, I'm going to hang up and just let your massage therapist continue their care, and you just check in with me later. And she checked in with me probably the next day, and she said, it worked. I finally was able to relax my body in a way that I have never been able to relax before. And the massage therapist mentioned how much easier it was to work with my body, how responsive my body was now. And I was able to really get the benefit of that other care. So that's an example of like, okay, there's an issue here. It's not the massage therapist's, she's not doing anything wrong, but what she's doing is just not benefiting the body because there's this underlying hidden issue.
There's
Let's
a
address
block.
that. There's a block. Let's remove the block. Okay, back to the massage therapist.
That's awesome. So you were able to essentially enable the person to receive the care they needed from that massage therapist. That's
Exactly.
awesome. What about you, Claire? Do you have any stories of things working together like that?
I'm thinking about it. Yes, for sure. And I also wanted to just sort of back up again and take the broader view and just remind everyone that there's more than one way up the mountain. That way, that day for that person worked beautifully. And there could be other ways. I think working with bodies, what it has really taught me is to just be open to what works. And if something isn't working, then be open to that also. That's feedback from the body, right? That's body language for we need a different way up the mountain, or we need to take some rocks out of my backpack, or whatever it is. But there are so many ways up the mountain that it's just like, I really feel like if people can address the belief system of, healing has to be hard, it has to take a long time, probably no one can help me except the very, very best, whatever. And I can't afford that, or whatever the story is. There's so many stories. And really, beliefs can be shifted if we want to. And simply considering the belief that your body was designed, and whether you're going to say that's by an intelligent creator God, or whether that's from random evolution or whatever, I don't care. But it was designed to heal, like obviously, or we would all be dead already. So I think it just that kind of base foundational relationship with our body and with our health is life changing, because that is where we're then going to be like, this isn't working. I maybe should address that energy piece or that physical
Mhm.
piece, because I haven't been. So I wanted to drop that in also. Okay, now, so times where it has worked well, for sure. I mean, I hate to keep harping on the jaw, but it's such an easy one. Everybody knows their jaw, right? I had a client who said she was going to go get a new mouth guard. And while she was on the massage table, I just asked her to open her mouth, and she had like a double S when she was dropping down. And I said, "Oh, please don't get a mouth guard now. That would be terrible, because then no matter what you do, you're going to sleep with that for 7 or 8 hours a night, and it will put your jaw back to this way that is out of alignment. And there's nobody on the planet who 1 hour a week is going to be able to adjust that if you get 8 hours a night undoing that work, right?" So I said, just give us 6 weeks. And we did a combination of craniosacral and Bowen. And then she went and got the new mouth guard fitted. And I didn't hear anything. So I called her up, and she came in and she scheduled, and so there she was on my table again. And I said, drop. Oh, no, she said to me, watch. And she just went, and it just dropped straight down. And that was like 3 months later. And
Mhm.
so that kind of satisfaction, where, as Tanai was saying, it's not just the what, but it's the when procedurally. That mouth guard was keeping it in line for her, but we had to get it in line first.
Mhm.
That's awesome. That's amazing that bringing multiple disciplines into one was able to synchronize their healing in a productive way. So, what I would love to do now is to go through a couple case studies, hypothetical case studies with you two of, again,
That's the fun
hypothetical
part.
patients,
So I'm excited.
hypothetical clients who have a complex issue that they're dealing with. They have a certain profile, they have certain symptoms, and I just want to essentially watch you two work. I want to present this client to you, and then we're just going to pretend that it's going to be the next weeks and months, maybe the first 2, 3, maybe up to 6 months of this client's care. What would collaboration look like for this client, and what would you approach first? What symptoms would you approach? We talked about synchronizing and making sure everything's in the right order. What would you approach first? What would you dig into? What type of questions you would ask? And then when would you call each other? When would you say, hey, this is something that probably requires something beyond what I have? Let's talk to Tanai or Claire and let's figure out how we can start working together. I just want to see what happens. Are we ready?
Ready.
Super
All right.
excited.
So, first hypothetical client is Daniel, who's dealing with chronic pain, emotional numbing, and neurological shutdown. Daniel is 36. He is having persistent lower back pain, tension headaches, and dissociative episodes. His background is in high stress tech job. He works long hours. He recently ended a relationship and kind of shut down emotionally as a result. Childhood instability has kind of shaped his tendency to detach from the situation just to kind of escape. And he does several different ways of doing that, either internally or externally pursuing an escape. And he often feels numb or foggy rather than anxious or sad. He kind of disconnected from what's going on inside. Or symptoms are physically, he has chronic tension, shallow breathing, restricted movement patterns. Psychological, he has kind of, like I said, emotional flatness, difficulty assessing feelings. And then spiritual, he's disconnected from intuition. He's very kind of cognizant, like mind driven life. He does the next thing. He does the thing he feels like he's supposed to do. There's no internal drive for that. He's told he needs to do that. And so he does. And then a lack of heartfelt purpose. He doesn't really know why he's here. He has kind of a disconnection from his sense of purpose or direction in life. How would you, let's start with Claire on this one. And then let's say that Daniel walked into your office and you began assessing Daniel and started walking through your intake and assessment. How would you work with this person? And then when would you call Tanai? And then maybe who else would you call?
Yeah. Wow. Daniel is really a complex, I call it a sophisticated presentation where all the systems are involved. I would start if he came referred for body work, I would give him body work and then, educating a little bit through the session about which muscles tend to be involved in our stress response, or we could think of it as a protective response, and prepare him at the, what do you call the out? It's not the intake, but the post treatment conversation. Um, that I believe the body is designed to heal and that it's going to probably be a process to take off different layers of his life experience to get to that core, the joy and the purpose and the feelings of ease and excitement about life and connection, right? Because he's connected from his own well or disconnected from his own well. But just to let him know that his body is there for him is where I would start. And there was some other piece. Oh, and I would of course empower him with suggestions for things he could do movement wise, like um, yoga for men and Tai Chi or Qigong or some of the more presence oriented body disciplines, because at this point, um, he would probably do fine with something like karate or jujitsu or whatever, but they're going to stay in his superficial body and his head where he already has a lot of competence, and we're wanting to crack open the gates to the other realms that belong to him. So things that would address directly the body and getting him connected with the body, that would be my first referral, was for him to develop those disciplines, qigong, tai chi, yoga, whatever. Yeah.
So what would clue you in that you might need to get someone like Tanai on the team?
Oh my gosh, it's essential for this beautiful man named Daniel. Absolutely. When he started to notice his body and his experience in the world and started to be curious about it, I would be like, yeah, now that you're actually present in your body and in your life, go, allow Tanai to support that connection of body and persona with spirit Does that sound like that would be appropriate tonight, or am I missing?
No, I wanted to hear how you would pitch it to someone like Daniel,
Yeah.
because
Yeah.
it tends, yeah, I mean, how might you pitch it?
That would be my basic reasoning was after, 3 or 4 sessions and he's like, "Yeah, I'm sleeping better and I'm actually waking up feeling a little bit rested and I just love the guys I've gotten to know at my yoga class," or whatever it is, right? And just that he's showing that he is more present in his body, then I'd be like, "Awesome. That's great that you've made so much progress already. And there's more. And there are other realms. And if you feel ready now, I highly encourage you, now that you've got that connection with your body, to take it to the next level. If you feel like you're not ready yet, that's fine. Your spirit will wait for you. But if now is the time, then I really want you to call this lady and I will help you take it to that next realm and be comfortable with that next level of development.
So initial call happens. Claire calls tonight and says, I have someone named Daniel that you should see. You perhaps fill her in a little bit more on the stuff that he's dealing with and the progress that he's made. And now he is sitting in Tenay's office.
Hey, so I would just ask Daniel to tell me a little bit about himself, anything that I haven't already heard from Claire, knowing that this burden to tell your whole story to every new provider you have, it's a lot. So we want to minimize that as much as possible. I would tune into what I'm feeling around Daniel. And as you were telling me his story, I really felt this desire to hug him. And then I also felt this desire for him to do like a movement practice like yoga. And I like the idea of Tai Chi and Qigong. And this idea that every time you said the word dissociated or disconnected, those are strong indicators of trauma, childhood trauma. And so this idea of hugging and just bringing safety and safe affection, safe non-romantic affection to the body can be really, really healing. Unfortunately, there aren't providers who hug people, right? And a lot of clients aren't comfortable going to someone and paying them to hug them. But there are apparently in some places hugging groups where you could just do like a meetup and people, they all just hug and cuddle. It's totally, non-sexual, non-romantic, but because a lot of people need this affection. I would ask him about how he's thinking about his experience, and I would look for clues for to see if he needs any spiritual cleansing. So if he has any despair-based thoughts, powerless thoughts, despair is like things are never going to get better. I'm always going to be in chronic pain forever. Powerless thoughts are like, there's nothing I can do to change this. This is just my lot in life. Fear-based thoughts like, or anticipating pain, if I tell anybody I might lose my job, or if I try to fix this, I might lose my relationship with my parents or whatever. Those kinds of
Or have a
thoughts. Those are all,
breakdown.
or have a breakdown. Yeah, I won't be able to handle looking at myself in the past. Then those are indications that he needs spiritual cleansing, because those types of thought patterns, though there's a psychological component to it, if they're stuck in that, and that's like a very deeply rooted thing, that's 100% you need to do prayer or whatever type of spiritual healing. There's shamanic versions and whatnot. But if he's open to Christian prayer, then Holy Spirit prayer to cleanse that. And then I would ask him to tell me times in his life where he felt like he had really gotten guidance from this universe, higher place, God, and ask him to tell me those stories. Maybe he was 5 years old and he was going to play with something electrical with a glass of water, and he felt this like, put down the water first, and he did that before he touched the electrical thing or whatever. And then I would start building up this belief that he can get spiritual guidance from an all-loving, all-seeing, all-knowing, all-healing higher power. And we just have to decode how he's already been getting that guidance in his life and help him replicate success. And then from that place of quick wins, or like, oh, we've already had a few wins in our lives, let's now expand to other ways of getting guidance and ways to test it and, do the scientific method. Like if you feel like, okay, if he says, hey, I'm going to Claire, I hear that I should go twice a week. instead of once a week. Then I say, okay, well, is that something you can afford? Call Claire and see if she's got availability. And then let's try it for 2 or 3 weeks and see if there's a marked improvement, if it's more than it was just doing it once a week. And if there's a marked improvement, then we know that you heard accurately. And we're going to write that one down as a win. And we're going to remember how we felt and what we were thinking, what we were feeling, what we were perceiving, what we were knowing, the situation we were in, what we had just done before, what we were doing after. And then we're going to write all that down and we're going to say, and then that resulted in positive outcome, which then implies causation, right? And that's the scientific method. I would also then invite him to learn a little bit about how to heal a complex issue like this. When you have chronic pain, dissociation episodes, highly cognitive, disconnected from emotions, disconnected from bodily sensations, that implies childhood trauma, usually generational trauma, if not childhood. That means that your parents had childhood trauma or their parents had childhood trauma. It could imply the spiritual cleansing needed that we talked about, social dynamics. So a lot of therapy, psychodynamic therapy, looking at his friend circles and thinking about how he engages in community, all that stuff. And so I could give him a little bit of high level education of how healing these complex issues would go. And now that he's got enough words and concepts, now take that to your higher power and let's ask, do I need a therapist right now? Yes or no? Do I need, and if yes, does it need to be a trauma therapist or a different kind of therapist right now? Maybe he needs more of a psychodynamic counseling or support, or maybe he needs a support group instead of just an individual therapist, right? And so just giving him the questions to ask, but then he gets to be the one who hears the answers. And then that gives him confidence to move forward with them.
So these are the initial meetups that are happening between Daniel and you, Claire, and you, Tenay. So what would the next couple months look like? What type of interaction would you guys have with each other? What would you kind of send him back and forth? And then what would the progression look like? And key in that is, who else might you bring into the picture?
Go ahead, Claire.
Yeah. So as Tenay noted, Daniel was exhibiting many flags waving that indicate historical trauma for his life. And so as he was developing that awareness spiritually with Tenay and physically with me and with his other practices, how he chooses them and wherever he takes them, there are lots of ways up the trauma mountain. And, little things like I've heard it said that it's really hard to hear your own, to follow your gut intuition if you have gut dysbiosis. And so that could be something like really looking at some sessions with a naturopath to help evaluate and treat how can we support this intestines on the microbial level, and that enhancing his intuition moving forward. So that's like one potential way he could go. Also, things like the primary reflex integration have some very powerful PTSD protocols that can be a lot quicker and a lot more foundational than a longer term with a trusted trauma therapist. But that doesn't mean don't have a trusted trauma therapist with a nice long relationship. It means these are all the options that are available. There are, I'm sure there's a bunch that I'm forgetting right now, but definitely helping him just see the options is another piece of what I love doing, because I've done so much on my own healing journey that I can tell people about how much is available to support them and help them discern what feels like a good fit for them, and then help them tune into their body, what feels like a good fit for me as a body. So that's what I would do next. And in terms of, I don't talk about clients without their informed consent and legal documentation stuff. So after I do the initial send off to Tenay, I wouldn't be like comparing notes or whatever. unless Tenay and Daniel came back and said, "Hey, I want you guys to be talking," and
Unless there was some sort of collaboration agreement with the
exactly.
client.
And then, of course, I'm happy to spend, 10 hours a week, problem, you know.
Awesome. Tanai, any thoughts on that?
Yeah, I love the idea of the gut dysbiosis, right? Because sometimes our bodily sensations are so loud that they just occlude any ability to even understand the thoughts running through our mind, or those are the conscious ones, or like the subconscious ones that we're obviously emoting as a result of, or our emotions, right? So when someone is in the beginning stages, the most important thing is to just stabilize their system first, right? And which is why when Claire said, if he came for body work, I'm going to give him body work. Why? It might not heal him right now, like in a deep way. It's probably not going to be a silver bullet, but it's going to start that stabilization of the system. Love the naturopath idea. Healing the gut-brain connection is huge. I would, if he's got infinite disposable income, then I would recommend like a wellness coach, just someone to help him with those life rhythms, right? The sleep and the food and the, all of that. Integrated medicine doctors, naturopaths, they help with the nutrition piece. And people tell you to sleep 8 hours a day, but like sometimes you really need to problem solve. How do I get out of all the rhythms that I've been building up all my life? And how do I create a whole new set of rhythms, a whole new life? And that can sometimes include getting a whole new group of friends and even a whole new job, right? So there's a lot to unpack there. And then the therapist to process the emotions with in that work right now, as well as usually a separate trauma therapist to do the childhood trauma work back then. And then integration parts work is the root of healing all trauma. But once you've healed all the trauma, you still have to remove the effects of the trauma from the tissues, the biological programming, the allostatic load, like the inflammation responses, like all of that chronic stress responses that your body has been doing for a long time because traumatized parts were triggered all the time. Now you got to go to like somatic experiencing and brain spotting and all of these other types of therapies that really try to deprogram your body from doing the way it's been doing life all these years. And that's where body work becomes so important. The Bowen work, I would send him back. Be like, okay, go back to Claire, ask for Bowen work. As far as collaborating with Claire directly, I would, one, does he want us to collaborate? If so, absolutely. Let's get together and let's huddle for 10 minutes, 15 minutes, and let's just see what comes up in the interaction. And then two, I would say anytime the thing that she's doing is not working the way it should be working, that's an opportunity to call me. Because then that either means that there's some spiritual block or there's a different kind of block that we need to pause this and he needs to get guidance to do something else to then come back and get the benefit of the work that she was trying to do before.
That is awesome. Thank you, Claire, and thank you, Tanai. That's amazing to kind of just watch how someone like Daniel might navigate the wellness system with you two as kind of their main coaches and cheerleaders and guides in that. I have one more case study. This one is going to be a little bit shorter because we've kind of already established a little bit of a pattern of care, how things would interact between you two. But I want to just give the viewers a little bit of an idea of if it were different symptoms, how might that shift your approach a little bit. So this is Nicole, who is aged 29. The presenting issue is that she has unexplained skin rashes and joint pain after some major life changes. Background is she recently ended an engagement and relocated, having to change careers. She's had sporadic autoimmune and gut issues over the course of her life, and she has a long pattern of perfectionism and people pleasing. She feels like she's kind of lost the blueprint for who she is after this breakup. Physical symptoms, just as a summary again, joint inflammation, fatigue, sleep disruption. Psychological, she has reactivity and racing thoughts and some fear of rejection. And spiritual, she kind of has a crisis of identity and direction after her breakup. How would you approach this? And let's start with Tanai. Nicole has now walked into your office, Tanai.
Okay. Well, if she's coming to see me, then she has a sense that there is a spiritual realm and that maybe the way she's been living life is not working and she needs to have a different blueprint for how to approach life. Hearing her symptoms, inflammation is a very common symptom of chronic stress, and chronic stress, it sounds like some of the perfectionism and racing thoughts and anxiety point to some childhood trauma, albeit probably not as much as Daniel from before. Then the eczema and skin rashes after a major life experience, that to me implies triggered parts that are using her immune system to communicate their need for care and healing. I believe that every single traumatized part that's dissociated from us when we experience a life-threatening event then takes over some function in our body. And then the more traumatized parts you have, the more functions in your body are disjointed. They're no longer synchronized because they're not being run by the same part of you. They're being run by different parts of you that peak when different parts are triggered, then that bodily system also peaks. So whatever part of her is triggered by this breakup, it could be some part that, was hurt by experiencing rejection in her family of origin, or maybe her parents got a divorce, or her grandparents, and her parents had a split or whatever, some sort of split trigger is now communicating that it's being triggered and it needs healing and care through this immune system response. I would explain that to her because I think the rash is probably the thing that she wants to just stabilize first. And, we can do some prayer on it. We can, recommend her to do some parts work with a therapist about it, but then also speaking to that system and saying, hey, immune system, I see that you're speaking loudly right now and you're being used to communicate. And now that the parts work is done, or maybe, now that the threat is over, the breakup is done, you can actually calm down and no longer be overactive like this, but we've heard you and we're going to care for you. So you no longer have to sound the alarm. And then tell her, like, now you actually do have to care for that part of you, right? Because we can't lie to your body. If we lie to your body just to get the symptoms to stop for a little while, and then, your body will eventually figure it out and it'll stop listening to you, right? So then I would recommend that she go to a parts person. As well, I'd recommend that this is a trauma therapist is one of the things that she should present to her higher power and then get guidance along about. And then when it comes to, deprogramming the body from the effects of chronic stress and inflammation and overactive, just the effects of trauma in the body, then I would recommend Claire to her if she feels that her higher power believes that that is a good next step for her to go to.
So what would indicate that you should point her to Claire for you?
Well, I would probably tell her like the way that trauma affects the body, affects the brain, affects the tissue and the muscles. And then I would usually say like, okay, now you know how it affects your brain, how it affects your thoughts, conscious and subconscious thoughts, how it affects your tissues, how it affects your immune system. Okay, which of these do you feel like you need to address next?
Yeah.
And then so I give the education, the health education, but then I give her the power of, okay, close your eyes. We can do the doors exercise, the 3 doors exercise, or to get a help from the spiritual realm about choice, or we can do the hallways exercise. We can do different exercises to help her practice hearing. And then if she says, yes, massage therapy, I hear that I need to help my muscles and my tissues, then I'll say, I know someone who does body work. Her name's Claire. Now go back and ask if Claire's the right one for you. Right one right now. Right. And then if she gets either a quiet or a yes, as long as there's peace and there's not like a lot of anxiety involved, then I would say, okay, here's the referral.
Now, Claire, Nicole has left Tenay's office. Tenay has sent you, with Nicole's permission, sent you some information. What would you start Nicole off with, and where would you take her?
I would start off with underlining the similar educational message of we're following your body as the lead expert in what you need for your process next. So I'm going to listen to your body and tell you in because I've got a bunch of assessment techniques that take a second and then explain, here's what I feel that your body is requesting for today. How does that land with you? Does that feel like what you want to do or not? Because we could do something very organ oriented. Maybe the organs are like, me. Or we could do something that was much more like muscles, right? And, we know that organs, we don't know, but lots of people believe that organs have specific roles beyond their physiological role, different emotions that they govern, et cetera. And so I would leave it up to Nicole's body and Nicole and think of myself as not a go-between isn't quite right, but a translator
Facilitator.
facilitating and translating. Yeah, so that she can be and again empowered in that relationship and with what are the next steps and what's the modality? How do we move where you are, which is wonderful and beautiful, to the next step beyond where you are, which is going to be more expanded and also wonderful and beautiful. I think that is.
And I think now we have an idea of what someone like Nicole or Daniel how they would walk through working together between your two fields of care. And I think we also have an idea of what that would look like for other people who would work through perhaps other different fields of care. And I feel like it's empowering just to get a picture of someone going to these different practitioners, different professionals, and being empowered to make the decisions, being empowered to trust their guts and then pursue, okay, this is what I feel like my next step. Here's what it is. Because there's a lot of people in my own experience anyway, where I've gone to the doctor and then the doctor may or may not know what to do with my symptoms. And so they say, here, take this medicine or try this remedy. And then I go home and that's it. And it's not really built into our culture of go do different things, try different people, and navigate this environment in that way, in a very empowered way. It's very much like, well, my doctor said this, so this is what I'm doing. And so I think it's really empowering to just kind of get an experience of working with different providers. And so I really appreciate you guys doing this and just walking through this with your different specialties. I would love to kind of get your thoughts on how this conversation, how the case studies, how this collaboration has felt for you, how this conversation has felt for you, and perhaps what it has opened your eyes up about the person or the field of the other person. Just what are your reflections on the last hour and a half?
I wish everybody had the unlimited funds that Tenay referenced so they could just try everything and see what they liked and go from there. Because to me, I often will say healing really sucks. The only thing worse is not healing, right? Because when you're in the trenches, it can get really muddy and not that much fun. But it also is like can't think of anything that's more satisfying on the planet than those inner triumphs when something that was keeping us small or contracted, we've been able to resolve or dissolve and be free. And I really think that healing individually has to do with our individual liberty, and also healing collectively has to do with our collective liberty. And that is our collective sovereignty is like, I mean, what other way matters to save the planet, really?
I was I was sharing with Tanai just a little bit ago how we were reflecting on our last 5 years of healing and all of that. And I just remember sharing, I would not wish this upon anyone.
Right.
However, I would never go back.
Bingo.
I wouldn't trade what I have gained for anything that I had before, because the life that I experience now is so much better than it was even before I kind of opened up the can of worms that was my own inner healing. But I wouldn't go back at all. Even though the journey itself was really difficult, I would
Right.
not go back. Tonight,
Yeah.
what are your reflections on the collaboration and the case studies and just working with other practitioners to help someone move through? What's been your reflection, your experience of this conversation?
Well, I think if we get me, Claire, a naturopath, and maybe two other clinicians, we could probably cure every illness in the world, right?
Yeah,
I
right.
I really just, I love collaboration. That's my heart. I love the magic that happens when you get multiple people in a room who all individually have some deep experience, but who have never had their experience um, be flavored by it rubbing up against someone else's deep knowledge and understanding, right? And so, but once two people interact, they're both permanently changed if they're growth oriented people. My dream is that we would have Daniels and Nicoles who do give us permission to collaborate. And maybe that's something that as practitioners, we have those agreements prepared and just offer it just in case. Hey, as maybe you say, I'm charging you for an hour, X amount of dollars. That includes one 10-minute collaboration with the provider of your choice, right? Or, 5 emails or whatever, right? Like I'm here to help collaborate with whoever else is on your healing team as much as or as little as you would like me to. And, maybe we try to remove some of the administrative and, financial red tape and then see what we can do with what we got. I think with someone, especially someone like Daniel, who has so much healing to do, if you could get like his 4 or 5 healing team members all on a call for 30 minutes once a quarter, I think it could really catapult their their understanding and therefore their approaches and how to help him progress to the next levels of healing. So,
And that would also be an education for the practitioners themselves, like you mentioned. And that means
absolutely.
that the next Danielle, the next Nicole that walks through the door, they are all the more prepared. And the system becomes more streamlined and they become more aware of, I need to call these 3 people and this, I need to look for someone to fill this slot, that sort of thing.
Exactly.
Well, Tenay and Claire, this has been an amazing and educating experience. Thank you so much for walking us through that. Thank you for talking about your own experiences and just sharing how things could work with a more collaborative environment in healthcare and in wellness. It's I look forward to that day, and I think people like you are going to lead the way to do that. So thank you so much.
Looking forward to it.
Yeah. Thank you. Thanks,
Thank you.
Claire. Thanks, Brett.
It's
Bye.
been lovely.